If you've been thinking about undergoing a breast augmentation for years but have been talking yourself out of it, this is for you. My name is Dr. Eric Barker, and I'm the plastic surgeon here at Peak Plastic Surgery Center, and I specialize in breast and body cosmetic surgery. The most important aspect of breast augmentation is ensuring that we pick the appropriate size, shape, and contour of a breast implant for each individual patient. In order to ensure that we pick the right implant for each individual patient, I will sit down with you during your consultation process to ensure I understand what are your goals. Not only size of breast, but it's also shape, position, contour. After we go over all of your individual goals that you're hoping to achieve at the end, this is when we start talking more about the implant size, shape, position of the implant placement, meaning above, below the muscle. And then after the consultation, I will have you send in a inspiration picture to ensure what we talked about during the consultation also matches the visual representation that you're hoping to achieve. When deciding a breast augmentation, there are multiple modalities of implants and other procedures that can give you the results you're hoping to achieve. So when we're talking about silicone versus saline versus fat transfer, how do we know which one is correct for each patient? Well, that means that I have to sit down and I have to understand each one of your goals. So I will go over what are pros, cons of each, what are the expectations of each, and what are realistic end results for each individual option that I will offer to you, so that you get to make this decision comfortably and in the most educated manner possible. So many patients are asked with a breast augmentation, will my results look natural? This is very, very common that people think that if you're getting a breast augmentation, you will end up with a very voluptuous, large, chesty appearance. This is not always the case. So when we're talking with patients and I give a custom recommendation to each, I want to understand, do you want to look more natural? Do you want to look more augmented? Do you want the upper folds of your breast to be more rounded? Do you want a more teardrop breast shape? This is all done by surgical technique and the correct implant that we place. So we will go over all of these expectations, all of these goals to ensure that we offer the right surgery for you with the right implant and or fat transfer procedure. When undergoing a breast augmentation, there are multiple incisions that can be made to place the implant. If it is just a standard breast augmentation, you can have it around the areola nipple complex, within the armpit, or underneath the breast. I prefer the inframammary-fold incision, which is underneath the breast. It is about 3 centimeters in length. It is very discreet. It is very thin, but it gives me the best visualization of the dissected field so that the results are consistent and I'm able to achieve the optimal results for each one of my patients. You can combine a breast augmentation with a breast lift in a single procedure. This is to address not only size and shape of the breast, also to address the position of the breast tissue, specifically the nipple areolar complex of where it's resting on the breast mound. So it is absolutely a possibility to undergo a combination breast augmentation with mastopexy or breast lift. So after hearing all this information about breast augmentation surgery, if you feel as though it's something you would like to explore further, please feel free to reach out. We'd be more than happy to sit down with you and discuss your goals, and so that you can feel empowered educationally wise, as well as get your questions answered so that you get to make this decision with as much confidence as you can.